Hi, everyone, and welcome. If you're a parent or a caregiver of a little one, chances are that you've dealt with a diaper rash at some point. But what happens when the rash doesn't go away, or seems to get worse no matter how many diaper creams you try? Today, we're going to be talking about a specific type of diaper rash called diaper candidiasis. This is a common but often misunderstood condition caused by a yeast called Candida. I'll explain what it is, how to spot it, what causes it, how to treat it, and most importantly, how to prevent it in the future. So, what is diaper candidiasis? Let's break it down. Diaper candidiasis is a fungal infection caused by an overgrowth of Candida albicans. This is a yeast part of the normal flora of the body, meaning it lives harmlessly on the body, in our skin, and in our gut. But under the right conditions, it can grow too much and cause an infection. Now, the diaper area is warm and moist, and sometimes it gets irritated from friction and stool and urine. Basically, that's the perfect environment for the yeast to grow. That's why babies are more vulnerable, especially if they've been recently treated with antibiotics, had diarrhea, or already had a skin breakdown from a regular diaper rash. It's important to note that not all diaper rashes are fungal, but once Candida gets involved, it needs a very different treatment approach. So, how do we tell that it's diaper candidiasis that is caused by a yeast infection and not just a regular irritation? Here are the classic signs of diaper candidiasis: bright red rash with well defined borders. It often looks shiny or raw. It can involve skin folds, which is a big clue because regular diaper rashes usually avoids the creases, but yeast thrives in them. Satellite lesions, these are tiny red spots or bumps that appear just outside of the main rash area. Sometimes the skin may peel and the rash may look almost oozy and moist. Your baby may cry more or be more sensitive during diaper changes. And if you're using standard diaper creams such as zinc oxide or petroleum jelly, and they're not helping in 2 to 3 days, that could be another clue that this can be a yeast infection. So these are some treatment options. Diaper candidiasis is very treatable with the right approach. Here's what your provider might recommend: a topical antifungal cream like nystatin, meconazole, which is available over the counter. You want to apply these creams 2 to 4 times a day, especially after diaper changes and before bedtime. It's important to continue the treatment for at least 3 to 5 days after the rash clears to make sure that the yeast is fully gone. To protect the skin and help healing, you can also apply a thick barrier cream like zinc oxide over the antifungal, but not under it. The antifungal needs to touch the skin directly for it to work. One important tip is to avoid using combination steroid antifungal creams like letrozole unless specifically prescribed. Because steroids have side effects, it can thin the skin with prolonged use, especially in infants. These are some prevention tips. So once the rash clears, here are a few easy tips to prevent it from coming back. 1. To change diapers frequently, especially after bowel movements. 2. Gently clean with warm water and soft cloth. Avoid scented or alcohol-based wipes. 3. Pat dry instead of rubbing because friction will irritate the skin. 4. Allow daily diaper-free time to let the skin breathe. 5. Consider using a barrier ointment if your baby is prone to rashes. And another point is, if your baby needs antibiotics, be extra cautious because they can disrupt the good bacteria that normally keeps the yeast in check. When to call the provider. If the rash isn't improving after 3 days of antifungal treatment, is spreading, or your baby develops a fever, always reach out to your pediatrician. And if your baby is getting frequent rashes, especially yeast related, it could be a sign of something else, like food sensitivity or an underlying condition, and your provider can help investigate further. So diaper candidiasis can look scary, but is actually one of the most common diaper area rashes, and it is highly treatable with the right care. Now that you know the signs and what you should do, you'll be ready to keep your little one's skin healthy, dry, and happy. Thank you for watching, and don't forget to clean, dry bottom is the best defense.